Hi, my name is Claire with Spruce PT, and today I'm going to show you how to use a rectal dilator. When you're trying to use a dilator rectally, you have a lot of options, but the most important thing to remember is that you need to have something with a flared base. This flared base, or kind of like a stopper, prevents something from being inserted rectally and kind of getting lost up there. So you want to make sure that no matter what, you're never inserting anything into your rectum that does not have this flared base or stopper. So this set is of vaginal dilators. However, sometimes I have patients use them rectally. It really depends on the situation, but that's okay because it has this stopper. Alternatively, you can get dilators that are designed for rectal use, which again also have this stopper or flared base. This is the smallest one that this company makes, and it goes all the way up to this size here. And so you don't necessarily need to use all of the sizes of dilator. You want to make sure that you're meeting your goals, which you would have a conversation with your physical therapist about. And so you don't, again, need all of the sizes or think that just because I'm using rectal dilators means I need to get to a large size. So you can kind of start with any of these sizes. And what I want people to do primarily is get into a very good, comfortable position. And this is the same with any other rectal or vaginal wand or dilator. You want to make sure that you're in a good, comfortable position with your core off. So I like to have people kind of lean back on a couch like this. You can do legs up like this. You can also be in a bed with pillows built up behind your back to kind of get into this position. You can also lay down on the ground with your feet up on a couch, or for rectal use, you can lie on your side and then kind of access the area from behind. So you'll want to use a good water-based lubricant. It needs to be water-based because you want to make sure that you're not going to affect the quality of the silicone. From there, what you'll do is just gently insert. And again, this should be uncomfortable because we're trying to make progress, but it should never, ever be painful. If you accidentally cause yourself pain with the dilator, you want to be just totally done for the day. So you're going to insert the dilator rectally and then just kind of hold, breathe, relax, and try to make sure that the dilator is becoming less uncomfortable with time. And again, should never ever be painful. You can kind of pull it from side to side or think about the area as a clock, and you're going to go to each number of the clock much more slowly than I am in this video, but this is just kind of for illustrative purposes. But really, usually I just have people insert and breathe. You can also do this kind of in a sitting position. I'd hopefully have your arm something like this so that your core doesn't have to be so on. But sometimes in order to get this into people's days, I'll have someone use this while they're putting their makeup on for the day or something else in the chair so that it can be done in just a few minutes and then you can kind of move on with your day. I know a lot of things in pelvic PT can be a whole thing, and so I try to make different exercises less of a whole thing whenever I possibly can. But overall, this is how you would use a dilator rectally.